One day, I was walking up the driveway with a sack full of clothes, and I had to stop, and I could not walk any further. I came in and I told my husband, I said, something's wrong with me because I can't breathe. I can't breathe when I do anything hardly. My doctor told me that I had aortic stenosis.
Aortic stenosis is a heart condition where the valve that sits right on top of the heart becomes stiff and tight. And so every time the heart squeezes, it has to generate extra energy to push that valve open. When we talk to patients about replacing their aortic valve, we talk about the risks of that. And we'll say, the risk of mortality is 1 in 500, the risk of a pacemaker is 1 in 10. But that's population-based data, and what that patient cares about is what the risk is to them.
We founded Dasi Simulations to bring innovative technology rooted in artificial intelligence and computer vision to help heart teams across the world personalize surgical planning for transcatheter aortic valve replacement.
Our technology helps the heart team better plan for these procedures by providing a predictive computational model. We take the CT scans from the patient, run tens or 20 or 30 different scenarios for that individual patient, and the computational model then predicts the likelihood of different complications happening. Our technology involves receiving the CT scans from the hospitals. The CT scans are uploaded into our cloud computing platform where we are able to compile all of the results back into a report that can be sent back to the physicians.
We have actually now become reliant over the last 6 months on using the Dasi simulation technology. I think that's really powerful to say that we have an experienced group of physicians who did this well are finding that they can do it even better. We used to do echoes for placement and determination. We then moved to CT technology for the placement of the TAVR valve. I think the next evolution is using the Dasi simulation technology.
At the core of the Dasi technology is the patient. Knowing what could happen before the procedure provides peace of mind, security, and confidence for patients and families. By personalizing one patient at a time, Dasi will bring life and joy to patients and their loved ones.
I can think of many situations where knowing ahead of time and predicting ahead of time complications that may occur would be astronomical to the care of patients.
When something like this happens to you, you think about what could have happened. This is my husband, my second marriage, so we have a lot of kids, a lot of grandkids, and I want to be here to enjoy being happy with them.